We're joined now by Republican Senator Pat Toomey, who is in Bethlehem, Pennsylvania, and Louisiana's Bill Cassidy, who is in New York this morning. Senator Toomey, I want to start with you. There seem to be two criticisms of the bill. We just heard Senator Manchin from the Democratic side, but on the Republican side, there are two criticisms: that too much of Obamacare is left in place, and then criticism from, say, Senator Heller, which is that these Medicaid cuts are too big. How do those get solved?
Yeah, listen, it's going to be a challenge, but I have to strongly disagree with the characterization that we're somehow ending the Medicaid expansion. In fact, quite the contrary. The Senate bill will codify and make permanent the Medicaid expansion. And in fact, we'll have the federal government pay the lion's share of the cost. Remember, Obamacare created a new category of eligibility. Working age, able-bodied adults with no dependents for the first time became eligible for Medicaid if their income is below 138% of the poverty level. We're going to continue that eligibility. No one loses coverage. What we are going to do gradually over 7 years is transition from the 90% federal share that Obamacare created and transition that to where the federal government is still paying a majority, but the states are kicking in their fair share, an amount equivalent to what they pay for all the other categories of eligibility. As far as some of my conservative friends who are concerned that the bill doesn't go far enough, I'm sympathetic about the kinds of reforms they would like to make to lower premiums through more market forces and greater freedom on the part of consumers. But I see this bill as a first step, a first important step in the direction of repealing those portions of Obamacare that we can, stabilizing the individual market, which is collapsing, and making important reforms to Medicaid. It's not the last step.
All right, let me ask, Senator Cassidy, you served in a hospital with a lot of low-income folks when you were practicing as a doctor. Picking up on what Senator Toomey said, the worry is on Medicaid is that as the amount of money shrinks, states just won't be able to cover all the people that need to be covered. What's your sense of that, and is that something that can be solved?
People will move off of the Medicaid expansion onto the private health insurance market, and that can be a good thing. It isn't so much whether we are spending lots of money on Medicaid, it's whether or not people are covered. Now, I have concerns about the bill, but let's acknowledge that as folks would move off Medicaid, they would go on private insurance, coverage would continue, and in some cases, that actually gives the patient more options for doctors that they can see than does Medicaid. So I think coverage could continue.
Will you support this bill, Senator?
Right now, I am undecided. There are things in this bill which adversely affect my state that are peculiar to my state. A couple other things I'm concerned about. But if those can be addressed, I will. And if they can't be addressed, I won't. So right now, I'm undecided.
Senator Toomey, on this question of people moving off of Medicaid into the private market, the concern from critics is that moving them off into the private market puts them in a market where they will be unable, because the subsidies are going away or are lowered in this bill, or the tax credits are shrunk in this bill, and because the people basically will be into a private market where they can't afford either. If the premiums are low, the deductibles will be too high, or both, premiums high and deductibles are high.
Yeah, John, obviously we've thought about that, and this bill provides very generous tax credits, considerably more generous than the House. They are more oriented towards lower income people, and those are the people who obviously need it. And I would also point out, I think it's important to note, the federal government spending on Medicaid is going to grow every year. It's never going to be cut. It's never going to shrink. It will eventually be growing at a slightly slower rate. And we need that in order to make the program viable and to deal with these massive deficits and the mounting debt that we have.
All right, Senator Toomey and Senator Cassidy, we're going to be right back in a moment. We got a hard break here, so we'll take that break and we'll be back with more on health care in a moment. And welcome back to Face the Nation. We're back with more from Pennsylvania Senator Pat Toomey and Louisiana Senator Bill Cassidy. Senator Cassidy, I want to start with you. In reporting on this and talking to Republicans, two things they really like in this bill are that it changes the Medicaid entitlement, something Republicans have been trying to do for a while to shrink costs, and it repeals a lot of the tax increases that are a part of Obamacare. How do those two big items make people healthier?
First, Medicaid in its current form is not sustainable. If you look at even under the Affordable Care Act, the state's portion of the Medicaid expansion cannot be sustained. In my state, it'll be $310 million a year. In California, $2.2 billion a year just for the state's portion. Now, I worked in a public hospital for the uninsured and saw many Medicaid. Why was I seeing Medicaid at a hospital for the uninsured? Because states could not afford their match, paid doctors so poorly that patients could not go see a private physician. If we can put Medicaid on a sustainable path, where the state is receiving a certain amount of money and can budget for that, and then the state in turn gives it to managed care organizations, federal, state managed care, the patient will have certainty as to their access. I actually think that's better for patients. I think that can improve outcomes, and it's certainly better for the state and the federal taxpayer.
Senator Toomey, you mentioned that there won't be cuts, that would just be the rate of growth that will be slowing on the specific question of Medicaid. But Governor John Kasich knows about budgeting. He was the former budget chairman of the House, so he knows about the difference between cuts and slowing the rate of growth. And he has said that in talking about this plan, that he worries that it cuts resources needed to help our most vulnerable. That's a Republican governor. Another Republican governor, Brian Sandoval, says these are our friends, these are our families, and these are our neighbors who he worries will get hurt as the rate of growth slows, because they just don't think that that will be able to cover future Medicaid participants. So they know the issues here. Why are they wrong?
Well, Senator Kasich was very much in favor of this very approach when he was the chairman of the Budget Committee in the House. Look, I get that governors like having a lot of federal money come in and spent when they don't have to even raise it. But the reality is this is going to grow. This is going to grow for the permanent future. We're going to fund the lion's share of even this new population within Medicaid that most Republicans didn't support in the first place. But, you know, there's another fundamental aspect to this. What we're trying to do is free the states and free the marketplace to discover ever better ways to deliver services. There's wonderful innovation that's happening all across the country. In Pennsylvania, whether it's Independence Blue or Geisinger, you know, an insurer and a healthcare provider, they are finding great new ways to deliver ever better care at lower cost. But there are constraints on the ability of insurance companies and providers to do that. We want to diminish those constraints so that we can continue through a creative process, discover better ways to do this. And this legislation at least takes us in that direction.
Senator Cassidy, 20 seconds. Majority Leader wants this done by July 4th. Why the rush?
I don't know quite why the rush. I frankly would like more days to consider this. That'll probably be a discussion coming back. I think a few more days to consider would be helpful.
All right, Senators, we're very grateful. Thank you both for being here.